doesn't hurt. Sure, it saves time because all the work, like there's this one girl that I just finished working with. She has 2 degrees from Harvard, bachelor's and master's. And she said, you know, before I came here, I've read at least 100 books about mind control, everything I could get my hands on. And she's been in therapy and everything. And I mean, she's bright, you know, master's from Harvard. And it's like she could never quite figure out how it happened, you know. She's because I think for her, one of the big keys still that she hadn't figured out is, even though a lot of these books talk about it, is that it can seduce bright people. That was the thing that she never could figure out until she got to Wellspring. And because of that, she had all this guilt, you know, that there's still something terribly wrong with me because they got me, this girl with a master's degree from Harvard. They sucked me in. I'm some screwed up defect from the human race, you know. And so we were able to fiddle with that. But, you know, even though we developed this model, it's still not an assembly line thing. You still have to, you know, it's like a surgeon, you know. Even though you know how to do surgery, each case is like, you know, oh boy, here comes another one. Every case is unique and it's different, and you've got to work hard, and you can't take anything for granted because you, like I said, it's a puzzle. You've got to look at all these different pieces, and you've got to learn how to kind of put it all together.
But do you sometimes have new people? I mean, people who have come up.
Oh, sure.
And that can work too?
Yeah, in fact, yeah, we've had people that are just fresh out of the cult that technically haven't had exit counseling. But this is one thing we will not do, nor will we ever do it, is try to convince people to leave. You know, we don't do that. But there's a lot of people that come out of the group and they know they need help, but they're still like, you know, they're still very much like, I hate the group, but I'm not 100% sure that I figured the whole thing out. The cult leader's still kind of a big guy, or, you know, and so but they want help. And that's the criterion. They voluntarily come to Wellspring and they want help. You're not there trying to convince them to leave. That we don't do. Yeah.
And you said about the Howard girl, but you know.
What's that?
You said with the story about the Harvard girl.
Yeah.
But you know, you could tell me the mechanism of mind control, so my guilt would go away. So I read everything, I know I'm right, everything, blah, blah, blah. Yeah. I still can't get rid of that little, what the fuck is wrong with me? You know
yeah, that was her thing. It was driving her nuts. Yeah, it was her sense of guilt.
Is it different from each case, or?
Yeah, everybody's different. You know, everybody's got something. You know, there's so many ways that this mind control wounds you. You know, some people get a bullet in the head. Some people get a bullet in the heart. You know, some people get it in the gut. You know, so the wounds are just kind of different.
I would like to share that my experience is that almost everybody who comes out has this feeling of being guilty and being ashamed.
Yeah.
And that's the most harming point to work on.
I was lucky to come back with the 2 other ex-members, and we working together. And that's been very good to see
Yeah.
them all together too, with all our kids.
Mhm.
Yeah, this relates to an earlier question. I work a lot with the cold intervention work, but when it comes to Wellspring, they're getting people like 5 days to 2 weeks after we're finished with them. So you're really dealing with people who have left that haven't been out of their group that long when they go to Wellspring. You know, many cases are of that type.
Seems very hot in here. Maybe I'm just hot-blooded.
Turn it up if you want to turn it down.
I think I did. But you can fiddle with it.
No, it's getting cooler. I feel cooler air coming out. Yeah.
Russ, I'm doing all.
Maybe up and down too.
Oh, maybe I should talk over this.
Stay with you.
Okay, treatment philosophy. We begin by doing a thorough intake interview. You know what that is? You know what an intake interview is? Where you ask all kinds of questions about your history and who are your parents, and you know, if you had a history of depression or anxiety, or if you ever used drugs or alcohol, or you ever abused, you know, just a million questions about your history. Your mental health history, your physical history, history about your family, so on and so forth. So we do a thorough assessment on that. And then we give a battery of tests in order to formulate a treatment approach.
In training?
What's that?
I just like come up. Psychologist.
Am I a psychologist? Yes. Yes, I'm a licensed psychologist. You can't do this stuff in America unless you're a licensed psychologist. Yeah.
You have to, so first you have to be from that.
Right. Anyway, treatment is a combination of psychological counseling, individual workshops, rest, relaxation, recreation, nutritious meals,